for the nursing fair this year, ICU had asked that we did a presentation on TVPs. So basically, a TVP, or transvenous pacer, is a temporary pacemaker that's inserted through a vein. The pacer wire is placed through the sheath into the right ventricle. It's generally placed under fluoroscopy, but it could be placed at bedside in an emergency. The wire is connected through a cable to the pacemaker generator box, and the pacemaker is in the ventricle, so the wire should be placed into the V slot. So on here we have A slot for atrium and V for ventricle. You'll see that the wire's in the ventricle. So TVP is used for heart block and for symptomatic bradycardia. The generator box is set with the heart rate. Usually we use 60 beats per minute, but it could be adjusted differently depending on the patient. And it's usually the ventricular rhythm that's placed, again, because we're in the ventricle. So there's also a few more settings. The output voltage, which is basically the milliamps required for us to have 100% captured beats. And then the sensitivity is basically the level the pacemaker knows to say, we see a P wave, we see a QRS. Basically, it knows what's going on in the heart based on sensitivity. Settings should be adjusted in cath lab before the patient gets to ICU, but you may have to adjust settings with the physician's orders. It's easy to adjust the settings. There's a small key on here. That's the button that we use to unlock it. You can scroll up and down and adjust the settings by twisting the knobs. I'm sure what everybody's concerned about is your nursing considerations and what you'll have to do. So you treat the access site just like a central line. Usually it's a femoral access site. Sometimes we use right IJ. We could even use left subclavian, which is where we generally access for a normal pacemaker. So the sheath will be sutured in place. You basically just want to watch the bandage site for bleeding, bruising, hematoma, and signs of infection. You would contact the physician with any problems with site complications. If a patient is femoral access, they have to be flat, head of bed less than 30 degrees, but all TVP patients need to be on strict bed rest. What you're monitoring for is the EKG for capture, so you're going to assess the rhythm and make sure you have a pacer spike for each beat. Also watch for arrhythmias. If the pacemaker is not capturing, there's a couple things you can do to troubleshoot. One of those is to check the connection. You want to make sure all the wires are nice and tight and connected. You check the battery life and contact the doctor because there's a possibility that you need to adjust the settings or that the wires are misplaced and you might need a chest x-ray for placement. One more thing when that is going on and you're waiting to hear back from the doctor, you should put external pacing pads on and have the defib monitor ready just in case. The TVP uses 2 AA batteries. They're very easy to change. There's a button on the bottom that unlocks the battery port, and you just stick new batteries in, pop it back closed. So we're going to assess the generator at each shift. You're going to look on here for the settings. Again, there's the heart rate, the output, and then the sensitivity. You'll chart the site assessments and the settings underneath the complex assessment. It's called pacemaker. It's just one of the flow sheets. If you have any questions, you know you can always call your friends down in the cath lab. And thank you guys for your time. Have a great day.